Hi, my name is Carmen. I am from the Fort Worth, Texas area, and I'm here to share my experience with medical vacations for facelift, neck lift, and forehead lift.
Hello, thank you very much, Carmen, for helping us showcasing a little bit more about the services we provide. Today is day number 10 after your procedure.
Yes.
So why don't we go and take a little bit step back and let you know, ask you, sorry, initially, how was your research process? How did you initially make contact with Cancun and the idea of having a procedure here?
Well, I was following a previous patient of yours, Dr. Arturo Valdez, for close to a year. And she mentioned medical vacations. So from there, I went to medical vacations and I spoke with a young lady, Patty and Aurora, and they kind of filled me in on everything to expect and price and procedure and what physician I could see.
Okay. And that contact and that communication included your evaluation with the surgeon who at the end who took your case and was very excited about was Dr. Patricia Panama.
Absolutely.
So what can you tell us about that initial reflection of yours of the surgeon?
Well, I wasn't really sure. I knew I needed things to be fixed because I'm 60 now. So I wasn't really sure what all needed to be done to get the maximum results. So I was very thankful on my first consultation with Dr. Panama. She suggested a couple other things I had not thought of because her goal was to get the 100% results that I was looking for. So that was very helpful, very, very helpful, her honesty. I don't think you need this, Carmen, but definitely let's do this, this, and this. So I trusted her, and I was glad I did.
Well, at the end, she's a true expert and being able to help many patients, no? And I think that's part of what we want patients, of course, to always have in mind that the surgeons that they're being talking to, they are vetted, that they are certified, that they have been experienced with international patients before. And the rest of it is in hands of our team. So tell us, so you made up your mind, you decided to do it. At the end, what procedures did you ended up having?
I ended up having a neck lift, full deep face, plain face lift. I had a forehead lift because I had the deep, deep furrows that were hereditary. I'm very expressionist with my face. So those are called static lines. And so the doctor said a forehead lift would minimize those significantly. And later on, I'll do like a CO2 laser. So the tiny little faint ones that are left there will be gone in a month.
Okay, definitely. It's an ongoing process, of course, but it's a facial rejuvenation, and Cancun has welcomed throughout the years patients for this type of approach. So we're happy that you completed this safely. And the logistics behind it, can you tell us like the preparation for your arrival, your perception as a patient, and then every appointment? Can you tell us a little bit about how you felt in that part?
Absolutely. So prior to coming to Cancun, I received an itinerary from Sweet Aurora, which laid out from the time I get off of the plane, where to meet my driver. And then I was transported to the condo to unpack and then taken and had full blood workup. I had a lung x-ray, back x-ray, everything they needed to make sure that I was good to go on the surgery, which made me feel very good because I hadn't had blood work or x-rays in a while. So they were very, very thorough on making sure that I was strong enough and able to withstand that type of surgery. So after that, I did my consult. I did my lab work. I was taken back to the condo where my hostess went and bought groceries and food for me. And then I slept that night, and then the next day went in for the surgery, and I was in there for 3 hours. Dr. Panama is an artist at her field of work. I am 10 days out currently. Each time that I woke up, I had a nurse come to my condo, cleaned my stitches, assisted me with showering. No humility left after that, but yes, they helped me get the blood out of my hair, get me all clean every day. Every day I could count on them to come. My post-ops, I'd be picked up by Anna. Anna's wonderful. She would carry me to the clinic or hyperbaric or massage therapy, whatever I needed additionally to help with my healing process. So overall, it has been a wonderful experience.
Well, we're glad that you're able to complete it. So, and also, you made this trip by yourself.
Yes.
So having the team, like you explained, was supportive enough. And actually, most of our patients travel by themselves. It's sometimes not easy to match agendas, and it's at the end something that's why this team has more than just one person. No, at the end we want to give the biggest coverage from the moment of arrival to your departure. Tell us about also in terms of your uh, intentions of potentially returning. Like if you did this, do you have any recommendations or any type of ideas that could improve this for you?
I haven't seen it, honest to goodness, and I'm a nurse, like there's always room for improvement. I haven't, I personally did not experience anything that would warrant me to say, hey, you need to improve this. My experience personally has been absolutely shocking, surprisingly perfect.
Oh, that is, thank you so much. We have, like I said, a team hardly working for this, and it means a lot coming from you that you are in a profession, in the medical field, who has literally a clinical eye to overview these type of things, to see these type of things. So it means a lot that you were able to share this. And what would you tell to somebody that is looking into this and possibly hesitating or having some second thoughts about this whole idea of traveling to Cancun for surgery?
Well, I have already begun to educate my friends and family and co-workers from Cedars-Sinai Hospital, where I worked for many years. There's a lot of women, when you're nurses, it's a hard life. And so this would be a dream come true for them as well. So I've talked to many of them since I've been here during my 14-day visit. And I think that they feel much more comfortable that I was their guinea pig.
Well, I think it's gonna give them a lot of comfort, of course, for many. So that's why we're very appreciative, and thank you for sharing this with more people, for trusting our services. We really thank you, Carmen, from in behalf of all of the team, and also being able to welcome you in Cancun, which is an easy flight, a very highly connected airport. So we would like to welcome more patients, and I'm very happy that your experience was successful.
Well, you're welcome for coming, but I just want to say thank you. Thank you for helping men and women be taken care of in a great bedside manner in the organization. This was a dream come true.
Oh,
And I thank you from the bottom of my heart.
no, Carmen, it's really kind words that we receive. We cherish them, and it just pushes to be better and keep improving, knowing that we have the patient's best interest. We
Absolutely.
have our own internal guide, and is to choose the best doctor for our patient, our client, our patient. And that's why we thank you for trusting our services, and we hope to see you again in Cancun. If you're just coming on vacation, we're more than happy to welcome you again.
Thank you, sir. Thank you.
All right.